Thank you everyone for joining today who's able to be with us. I'm going to go ahead and share my screen here. I'm an HR specialist here. I do a lot of the recruitment as well as benefits and sort of a number of hats within HR. I really love working here because we have such a diverse community of individuals, not only our patients, but the employees and kind of the team here is just a really good collaborative group of unique people, and I love it. CHCB is designated as what's called a federally qualified health center. So for folks who may not be familiar with that, we provide community-based primary care services to underserved areas and populations. So just as kind of a brief descriptor of some things that we do, we provide care on a sliding fee scale based on ability to pay. And we do operate under a governing board of directors that includes our patients. It's really important for us to have our patients be directly involved in ensuring quality of care here and really letting us know what they want. So we have that really tight-knit connection to the community, which I appreciate. A little bit about our history here. Burlington Health Centers, Community Health Centers of Burlington started out as what's called the People's Free Clinic. Right in 1971, we were here on the corner in Burlington. This little picture on the left-hand side, you can kind of see what it initially looked like. And it was actually a volunteer-run program at first. It was a medical care facility solely of volunteers, small group of doctors and nurses, and they served about 50 people a week. So now we are a full-blown 320 employees with 10 locations within Burlington. We've got sites in the Champlain Islands, as well as a few locations in Burlington, Winooski, and South Burlington as well. And we serve about 30,000 community members annually at this point. I do want to show a short video clip here just to give a little bit more insight.
Welcome to the Community Health Centers of Burlington. Please join us for a virtual tour where we'll share some information with you about our history, locations, programs, and services. In 1971, the People's Free Clinic opened in a tiny storefront in Burlington's Old North End. Announcing a new kind of healthcare, the People's Free Clinic founders envisioned a mission that would make a resonating statement. Every person, regardless of age, race, class, or gender, deserves good medical care despite their ability to pay. Staffed entirely by volunteers, the small clinic saw 50 people per week by the end of the following year, often treating minor wounds, providing health information, and 6 visits too. Soon, the clinic would strengthen its commitment to grow, and in 1980 became the Community Health Centers of Burlington, or CHCB. CHCB was officially awarded the federal status of a Healthcare for the Homeless Program grantee in 1989, and today remains the only organization in Vermont with this designation. This ensures completely free access to healthcare for individuals and families experiencing homelessness. CHCB was then designated Vermont's second federally qualified health center, or FQHC. As an FQHC, we are required to offer services like the sliding fee scale, a financial assistance program which determines the amount a patient pays based on the amount they make, up to 200% of the poverty rate. Even if you have insurance, if you have a high out-of-pocket deductible, you may still qualify for assistance from the sliding fee scale. Also, as an FQHC, we are required to have at least 51% of our board of directors comprised of patients. This is great because we have these volunteer community members at the very top of our organization able to give feedback on the patient experience. In 2001, we moved into the space that would become our flagship main facility on Riverside Avenue. And in 2004, we began offering dental services. It was at this time we also opened our school-based dental center. This serves any uninsured or income-qualifying student in the entire Burlington School District. This removes not only financial barriers to dental care, but transportation barriers for parents without vehicles or time to take their kids to appointments during the day. Part of our homeless healthcare program is also our Pearl Street Youth Health Center for patients ages 13 through 25. This program specializes in serving at-risk or homeless youth totally free, giving them access to medical, dental, and counseling services at no cost. In 2009, we received a generous and competitive federal grant to renovate our Riverside location. We demolished and rebuilt the space into its current form in 2012. The tremendous growth of this new Riverside Health Center allowed for more than 400 new patients per month to make CHCB their healthcare home. It also allowed us to increase our programs and services, notably integrated psychiatry and counseling and treatment assistance for patients struggling with alcohol and drug use disorders. During the same year, CHCB established our first rural practice in Grand Isle County, ensuring access to care for 3 surrounding towns after the sole physician in the area retired. This practice transitioned to a new site in South Hero in November of 2016, operating as the newly renamed Champlain Islands Health Center, and expanded access to care even further for residents of southern Grand Isle County. 2016 also saw the addition of Burlington Primary Care, since renamed our South End Health Center, and welcomed Good Health Internal Medicine in South Burlington to the CHCB family. The following year, the South End Health Center added a dental center, transferring dental operatories from the Safe Harbor Health Center. Throughout the year, CHCB continued working with community partners on the permanent housing program at Beacon Apartments and Bel Air Medical Respite for individuals experiencing homelessness. Winooski Family Health joined CHCB as our 8th location in May of 2017. Located in our medically underserved area, this partnership extends the federally qualified health center services to their patient base while uniting our already aligned missions of care. Throughout all of the facilities growth, specialized programs like our maternal child health program and our transgender health program have flourished. We created a BU specialty clinic for the broader LGBTQ+ community, as well as a child psychiatric consult clinic for external providers to refer to CHCB's specialty and availability. CHCB's story is one of continued growth, now caring for over 30,000 patients. As the community need continues to grow, so does CHCB. Community members and partners look to us to do what we do best: provide affordable, quality, comprehensive healthcare to all who need it, regardless of financial status or life circumstance. Together with our community, we look forward to many more decades of careful stewardship of our remarkable mission.
So that just gives a little bit of background on not only our history, but sort of where all of our locations are. All the folks in the video, are people that I know personally, because it's really nice that we are a tight-knit community here. So really all the staff know each other. So even recognizing, folks, friends and family, re-watching that video again when I'm seeing our staff members. So it's just a really great community. But you're all here to hear about available opportunities. So these are sort of our current opportunities available right now. We are opening up positions all the time, so keep your eye on the website. But currently we just posted for a director of behavioral health. So that's going to be someone who is a director of all of our mental health programs. So we are looking for a licensed clinical social worker or a psychologist who has at least 5 years of management personnel experience as well in that director role. We are looking for some medical assistants as well. We do prefer folks have some medical assistance experience previously, but we are open to hiring folks who have an interest in patient care and have a BLS certification as well, have that CPR knowledge. The patient accounts rep position, specifically, we're looking for folks who have sort of a dental billing background or some sort of knowledge of dental. An LPN to join our family practice here in, locally in Winooski. A dentist, a medical records representative, and then some per diem staff we're looking for as well to join our team. 2 RNs specifically to help with vaccine distribution. With COVID-19 going on, we are actually becoming a location that's going to be distributing vaccines in the Champlain Islands. So we're looking for some RNs to help with that very important mission, and also some patient services representatives to assist with that as well. So some per diem folks also in the Champlain Islands to make sure that checking in is smooth for those individuals getting vaccines. And then per diem medical respite sub is something that we're always sort of looking for additional subs at our homeless healthcare location at Bel Air. So let's talk about some of the benefits that we have as an employer. Folks always want to know what sort of things an employer offers in terms of that. We have health insurance through MVP. Something unique about that is that it does kind of cover domestic partners. We also have what's called an opt-out stipend for those who may have some alternate health insurance. So if you've already got that, this can provide you just with some extra monthly cash to have. We also have a flex spending and a DCA account. You don't have to have other health insurance or benefits enrollment in order to get those. And then vision and dental coverage as well. Through our MVP health insurance, we have a few wellness perks. You can get up to $600 annually. Part of that is reimbursement for a gym membership or massage therapy. And then the rest is through just online wellness assessments and tracking of movement merits or steps. So just participating in some healthy challenges. And then there's also a CVS discount. We have some other things that are no cost to the employee: basic life, which is up to $100,000, short-term and long-term disability. These are all inherent with your as being an employee here. We do offer some additional coverage under life for additional purchase. And then our time off benefits, we keep CTO and holidays separate. So it's both that you get. You get 8 paid holidays per year. One is a floating holiday. And then in addition to that, you're going to get CTO, which is accrued time off on a pay period basis. And that, sorry about that, that is going to include your sick, vacation, and any personal time as well. Our 401k is through Vanguard. And what's unique about it is that regardless of whether you contribute or not, after 1 year and 1,000 hours of service, as an employer, we put 3% of your salary into 401k for you. So even for our folks who are not contributing to their 401k, we make sure that something is in there if they have completed 1 year of service here in 1,000 hours. And of course, we do encourage folks to participate in contributing to their Roth or to 401k traditional. But if you're not, we are putting something in there regardless. CE funds are another part of benefits here. I'll be frank that CE funds are primarily designated in specific areas. So there are set amounts for different providers, for RNs, and that funding does, excuse me, does change annually just based on the budget. And then other positions may have an opportunity for continuing ed funds as well based on the budget and supervisor approval for that. And malpractice for our providers is up to $1 million each person for each claim. And some final benefits and perks that are available to all employees. So regardless of whether you're per diem, part-time, what have you, we have Reliance Standard, which offers travel assistance, bereavement support, ID theft, and employee assistance program, which you can have up to 3 counseling visits and many other things. They'll help you with financial questions. And then local discounts, we have an extensive list, and I've just kind of put some highlights on here, including a nice discount we have with the Edge Sports and Fitness. And we do not have a discount with the Intervale, but we are a drop-off location for them. And there's a list longer than this, but this just happens to be some highlights in that. So that is sort of our kind of comprehensive benefits and a little bit about CHCB. This is Chol Dor here. I was actually just chatting with him this morning. If anyone knows him, he's actually recently been in Vermont Business Magazine, as I was chatting with him about this morning. And he's also a 40 under 40 rising star, if anyone's familiar with that. So we're just really proud of his recent accomplishments in that. So, and he's got a great mask. So this is just an awesome photo to share on our presentation anyways. But thank you for having me. If anyone's interested in applying, you're welcome to reach out to me with questions and also send your resume and cover letter right here to hr@chcb.org. That's Community Health Centers of Burlington. And we're happy to field any questions too that anyone has after the presentation via that email as well. But I'm also open to questions that folks have now. So I'll open it up over to Sarah.
Jen, thank you again for all your information and your wonderful presentation and sharing all. It's great work that you're doing. Really wonderful.
Thank you so much, Sarah. I really appreciate everything today.